Welcome back. Georgia's recent surge in COVID-19 cases could be reversing course, but some central Georgia counties are still seeing increases. Today, the state reported about 3,700 new cases. But how does that track against the trends? Caitlin Heck breaks down the latest numbers.
We're finally seeing a tipping point in the statewide case curve after the most recent surge, so let's take a closer look. Cases started climbing in late June and finally topped out here toward the end of August. At that point, the state averaged more than 9,200 new cases a day. The average dropped by almost 1,000 a week later. Georgia never surpassed January's surge that topped out at an average of nearly 11,000 new cases a day, but we did almost double this peak from July of 2020 at less than 4,700. Bibb also reached a tipping point in late August, averaging 187 new cases a day. You can see cases start to drop but then creep back up again right before the preliminary window. By the last day of August, Bibb averaged slightly lower at 173 new cases, but added its highest number of cases of the entire pandemic that same day, with 286 people getting sick. Even after the slight drop in new cases, Bibb's average is still above the highest point from the surge in January at 159. Houston County shows a pretty definitive drop in cases after reaching its peak of 204 new cases a day on August 24th. That same day, Houston added its second highest number of cases for the entire pandemic, with 264 people getting sick. The average still dropped after that, though, getting down to near 180 by the last day of August. That's finally below January's high of 196 new cases a day. Right now, Lawrence County has the highest spread rate in our area. Lawrence had what looked like it could be a similar peak in late August at 70 new cases a day. Numbers dropped slightly, but you can see cases already start to climb again into the preliminary window. Health experts questioned whether travel and get-togethers over the Labor Day weekend would keep cases climbing. Well, the holiday still falls well within that 2-week preliminary data window, so the state's still counting tests from that time. Anyone who did get sick may have taken a few days to show symptoms or get tested, so it will likely take at least another week to really see the impact, if any, of the long weekend. We'll, of course, continue to track all the numbers for you so we can break down the latest trends. I'm Caitlin Heck, 13 WMAZ News.
And on the vaccine front, 40